Hello, I'm Dr. Molesky, and I'd like to welcome you to this video presentation on knee pain. And I want you to know that you made a very wise decision to watch this video. You're going to find some real answers to your knee pain problems. I find that patients are very frustrated because they come into my office looking for answers, and they've been everywhere and they can't really find answers to their problems. I had a lady come in to see me. She was about 70 years old. And she says, well, they recommended me to replace my knees. And I just don't want to do that. I hate the thought of it. But she was in so much pain, she could barely get around. Well, she was really excited to learn about our integrative approach to this. And what we look at is how can we improve the function of a joint or any kind of problem you would have that's of a chronic nature. And her knee pain was remarkably better after we treated her. We treated her over the course of 3 months, and I mean, she's out now traveling. She's going up to Seattle to visit her family. She's up and down stairs, and she's not needed any medications, any surgeries, anything. Just the protocols we use here with our integrative care for our knee pain. So we'll be touching on that and talking to you more about that as time goes on here. I'd like to talk to you about my background and why should you listen to me. Basically, I've been at this for 36 years. I just love natural health care. I live and breathe this 365 days a year. I just love what integrative care can do for people with chronic conditions. I mean, it can give you your life back. 36 years ago, I became a chiropractor. And I want to talk to you about that because a lot of people have a lot of misconceptions about what chiropractic is. I come from a very medically oriented family. My grandfather was a pediatrician, my mother was a registered nurse, and we were very, very much into the medical model. And I always thought I wanted to be a doctor when I grew up. And so I thought about different types of doctoring, and I decided I wanted to go into surgery. And so I was taking pre-med courses at my college time, and my sister developed really bad migraine headaches. So bad where 3 or 4 days a week she was in bed. In dark room, she would vomit. She was just really, really sick, and she went to all kinds of doctors and specialists. I'm asking my professors in my pre-med courses, well, what do we do with this? How do you handle this? And trying to get some ideas to help her, but nothing was helping her. As a last resort, she went to an ears, nose, and throat specialist who told her that the sinuses on one side of her head were smaller than the others, so he took a needle and injected cortisone up into the sinus. And she's telling me, I could hear it crunch, and she talked how horribly that felt. I mean, it was the worst pain she ever felt. And she had it. She said, I can't do any of this. It's just not working for me. And so we didn't know what to do with her. Well, one of her friends came up to her and says, why don't you go to my chiropractor? And I thought, why would you go to a chiropractor? What the heck's that got to do with migraine headaches? I didn't really know what a chiropractor was, but I was pretty sure you weren't supposed to go to one. And she said, yeah, I'm going to go. And I thought, wow. So she goes to this chiropractor, and this doctor looked at her, changed her diet, worked on her spine, worked with her nervous system, and I'll be darned if after a month or two, she's only one headache a week, every other week, and her headaches went away. And I thought, wow, that's kind of interesting. But I kept on with my studies, and probably 6 months later, my father came down with rheumatoid arthritis. And I mean, it got bad. His wrists started swelling, and they got really painful. And so he goes to his doctor, and he diagnosed him with the rheumatoid arthritis and said, here you can take these pills. And so he followed that recommendation. And probably 2 or 3 months later, all of a sudden he's in the emergency room with a heart attack. And we all go to the hospital, and they says, hey, it wasn't a heart attack. He reacted to the medicine for the rheumatoid arthritis. And my dad was livid. He says, well, I'm not taking it anymore. I said, well, if you're not going to take it, you're going to hurt. And he says, I don't care. I'm not taking it. It's just too scary to have the feeling of having a heart attack. So he stops taking it. And I'll tell you what, things got worse. He stopped taking it, and his wrist blew up like a grapefruit. I mean, knuckles, everything swelling. His skin turned ashen gray, and he would just get up out of chairs, and just tears coming out of his eyes. We had to help him out of chairs, and but he wouldn't take any painkillers or any anti-inflammatories. So what are you going to do? Well, my sister said to him, why don't you go to my chiropractor? And I thought, well, give me a break. Why are you going to go to a chiropractor for that? Well, he went, to my surprise. And I'll be darned, this chiropractor looked at him, gave him some exercises to do, changed his diet totally, gave him some natural anti-inflammatories, and over the next month or two, his wrists went down, all the pain went away. He was back to normal again. And I thought, that is just too coincidental that two family members react that way to this chiropractic. So I went and I learned more about chiropractic, and I was really surprised what I found. Chiropractic is really the largest natural healing profession in the world, at least one of the largest. It's not just about bad backs. When we go to chiropractic college, we're trained all about helping the human body to heal. Our philosophy is that the human body is an amazing creation that was designed to heal itself. And so we learn a lot about physiology, orthopedics, all these different venues to help the body heal. So we would counsel people on exercise, diet, nutrition, any natural means for the body to work right. I was probably the second year of my chiropractic college before I knew that people really thought of chiropractic as for back pain. I didn't ever think of it that way. But that's my chiropractic story. Since then, I've attended thousands of hours of postgraduate education. I just love learning more and more and staying abreast of what's going on. Again, I say I do this 365 days a year. I don't read novels, and I'm reading journals and reading about nutrients and new advances in natural health care for chronic conditions. In that time, I'm a graduate of the American Functional Neurology Institute. And what functional neurology is this different than regular neurology. When you go to a neurologist, they'll go through a lot of tests. They'll be sticking needles in you and different things, and they're looking for like hard lesions, brain tumors, things like that. With functional neurology, what we're looking for is how the brain is functioning, and is it functioning equal left to right, top to bottom. And it's really, really important. Your brain is a master computer. It's taking all this information in and it's putting information out. Your brain's telling your heart to beat, your lungs to breathe, your feet to move. It knows where your feet are. And it's really, really important that the brain is healthy, because the brain can get unhealthy and get out of sync. And when it gets out of sync, it's kind of like having your tire out of balance. It's going to thump when you're driving down the road. Well, your brain can be doing that, and it's not good. Over time, it can lead to more problems. So with a functional neurological exam, we look and see if your cerebellum on one side is firing the same as the other. And it's important that you have a balance to that, because that balance is going to go all the way down to your knees and your feet. And we want to find out why your knees have a problem. So the functional neurology is very, very important for that. In addition to that, over the years, I've become board certified in integrative medicine. Integrative medicine is, again, different. You look at the body as a whole. We've come to an age now where we're into specialties. People go to their heart doctor, their lung doctor, their kidney doctor. But in reality, we're this human organism that functions, all those systems interplay. And with integrative medicine, we want to look at all those things and what can we do to make the whole body function better. So, because if we can correct the function, we can correct the problem. I also have a fellowship in applied spinal biomechanical engineering, and this is a system of evaluating the spine and balancing the spine so that it's balanced and even. You could have a back problem that you're, without, as an exaggeration, you may be walking around like this for the past 30 years. And you may ask, well, why is my right knee degenerated and not the left? It's because you've been walking like with one foot up a curb for the past 30 years, and it'll cause a grinding wear and tear. If you have that going on, we want to fix that too so that we get the pressure off that knee and stop the degenerative process. In addition to that, I've attended all kinds of hours in metabolic analysis. With metabolics, we're going to look for your body metabolism, how your liver's working, your kidneys, all that comes into play in how your body's functioning and how the cells are getting nutrition or not getting nutrition. So here's what we're going to cover. We're going to cover signs of knee derangement. Derangement is the terminology used for a knee problem, and we're going to talk about the different signs of that. We're going to then talk about the causes of knee problems, and then we're going to go through the orthopedic and neurologic evaluation and therapy for those knee problems. First off, signs. Crunching, popping in the joints, degeneration, bone on bone, cartilage damage. You can have tendonitis, bursitis, arthritis, obviously pain as well. So what are some of the causes? These basically are the causes of knee problems. Breakdown of the nerves in the leg. If the nerves in your leg are breaking down and not working right, nothing in the leg is going to be working right, and it'll start to fall apart. It's important to have those nerves evaluated to make sure that they are firing evenly, that they're not being impaired. And we find that out in a functional neurological exam. Brain and nerve system imbalances. I talked about that before. Your brain's this master computer, and it's what dictates your posture, your heartbeats. It knows when you put a foot forward to walk. That's all feedback loop, and your brain and nervous system has to be balanced to have balanced legs, balanced muscles, balanced body in general. Nutritional deficiencies can also cause problems in joints. You're going to be deficient in magnesium or different vitamins or minerals. In addition to that, state-of-the-art look now at things. People have heard of glucosamine and chondroitin. Well, there's nutrients now called medical foods that are actually designed to stimulate your own body's stem cells to regenerate cartilage. And they can actually show you these studies where you'll see new cartilage growing. Now, if there's cartilage in there, you can actually help that to regrow. And it can take a long time for it to do it, but pain relief can be very, very quick. So we would cover that as well. Knee trauma, you can have an injury to a knee. You may have fallen on it years and years ago. All kinds of traumas can occur to a knee, especially if you played football. You could have damage to your spine. If there's lower back, the nerves come from the lower back and they go all the way down into your feet and your knees. And if the discs in the back are all squished down and chomping down on the nerves that go down into the legs, the nerve flow is interrupted going to the knee, and the knee's not going to have the right stability. So we want to look at that. The leg muscles in the knee can be imbalanced, especially if you've been walking around like this for 30 years. The muscles are going to get weaker on one side compared to the other. And what we want to do is identify that and then use therapies that will strengthen those up and balance those muscles, as well as give you exercises for that. The other cause is chronic inflammation. A lot of people have inflamed cells in their body, and the knee is inflamed. And it's like having a blowtorch on your knee. You need to take the blowtorch off so it can get better. If you're the type of person that's got like your fingers hurt, your toes hurt, your elbows, different joints in your body, aches and pains all over, there's a good chance you have chronic inflammation that's metabolically oriented. And we would address that because we want to get that out as well so your knee can heal the best it can. Trying to get better with inflammation in your knee is like trying to build a house while it's still on fire. I mean, you need to put the fire out and then rebuild the house. I want to show you some x-rays. This is a normal x-ray of a knee. This is the outside of the knee. This is the inside of the knee. And there should be a nice cartilage plate in here. This is your meniscus. Here is a knee that is degenerated. This is the outside of the knee, the inside. And you can see here's the space here. And here you can see where this has really come down here. There's no space. This is what people would call bone on bone. There's calcium spurs in here. And we see a lot of people like this in our clinic. It's interesting, usually it is the medial part of the cartilage that wears out as opposed to this outside part. Here are knees side by side, left and right knee, and we're seeing the inside part of this right knee is worn compared to here, and we have some calcium spurs. And then over here it's worn, but not as bad as this side, but it is worn more so compared to here. Now we'll actually grade knee degeneration on a scale. This is called a Kellgren-Lawrence scale. And you can be a grade 1, 2, 3, or 4. If you're grade 1, it's a lot easier to get better. You're having knee pains, but the cartilage has got good plate in here. The meniscus is full. As it degenerates, it gets smaller space in here. You start getting calcium buildup, and it starts wearing down more and more. Grade 4 is an advanced grade stage of this. So what's the medical approach to knee problems? Well, you've probably already done that. The medical approach is going to be anti-inflammatories, painkillers, physical therapy. When that doesn't work, maybe they'll go in and scope it. If that doesn't work, they're going to say, hey, you've had this, it's bone on bone, time to replace the knee. I find a lot of people don't want to have their knees replaced. And I have a lot of patients that have come in here that have had their knee replaced. Having your knee replaced is an expensive ordeal. I mean, it can cost you, most people don't know because of insurance, but it can cost $45,000 to $60,000 to have a knee replaced. And I've had a lot of patients that have had them come, and they come into my office because their knee still hurts, they have problems, and we still treat them and work with them. But there's no guarantee that that expensive surgery is going to really work 100% or as much as you want it to. So we do integrative approach to it. Our integrative approach to knee problems is we do an orthopedic and neurologic exam. We're going to review your blood work. We're going to look for any signs of chronic inflammation in your whole body. Why is that knee wearing down there? We then, again, will give you nutritional support that's designed to stimulate your own body's stem cells to regrow. And we've seen amazing results with this. we will give you specific therapies that will help to rebuild the tissue. And these are typically going to be what are called cold laser therapies. And we're going to talk about those right now. This lists the different therapies that we do to rehabilitate your knee. Class 3 laser therapy, spinal decompression, knee decompression. There's peripheral nerve therapy, microcurrent therapy, and neurological therapy. So let's talk about the laser therapy. Most people aren't really familiar with cold lasers. They know about hot lasers. Hot lasers are these lasers you're used to seeing in surgeries. They're a high-powered laser, and they can actually cut tissue and destroy tissue. And that's great technology. But cold laser is a laser, but it's not a high-powered laser. It's further down the scale of laser. But they've used lasers for like 50 years in Europe, and they've actually found that there's certain frequencies that cause tissues to regenerate. When you hit a certain frequency on tissue, and there's a setting for ligament, tendon, meniscus, muscle, it actually puts energy into the cells, and it causes those cells to wake up and start churning again, and it just brings them back to life. And when it does that, I mean, tissues heal. You're going to get cells regrowing. You're going to get increased metabolic activity in the cell, reduced scar formation. The cells will just work better. The proteins will start cranking out in there again. It's nice to get the inflammation down, because as that inflammation comes down, you get more mobility and less pain. So there's lots of studies that you'll see online. We also have a packet we give you that talks about the different studies on lasers. And the laser is a tremendous therapy. It works so well. It's very proactive. It actually helps to heal the tissue rather than just to cover a symptom. And there's no side effects to it. I mean, it's a win-win-win situation. Okay, another therapy we would use would be spinal decompression and knee decompression. Studies will show you that when you decompress a joint, like this joint's been squished down forever, and when you decompress it, open it up, you actually stimulate those cartilage cells to regrow, and you'll cause replication of those cells. And so we have this table that if you have that in your back, where the discs in your back are all flattened out and it's crushing the nerves going down the legs, to put you on this table, it would actually open up that space and help open that space up to free the nerve up. You can do that on your knee as well, where it can open up the space in that knee and stimulate that cartilage to replate. Painless too, by the way. No, people will be on a table for half an hour and you'll hear them snoring when we're coming down the hallway. So that's all these therapies. None of them hurt, interestingly enough. Another therapy is peripheral nerve rehabilitation therapy. This is a microcurrent therapy where we put pads on your feet and it runs a current up one leg and down the other. And it's, again, timed to the proper frequency of the nerves that are in the leg. And so people may have neuropathies with their knee problem, and this helps wake those nerves up and balance them up. It helps to balance the whole body. And we want to create total balance so that your knee can heal and not be a constant problem that you're dealing with. Then we have the neurologic therapy. And again, as I said before, with neurologic therapy, it's very, very important because your brain talks to your whole body. Your brain talks to your cerebellum, goes down through the spine, out to your knees, your feet, your legs. That whole linkage has to be intact, and it has to be functioning properly for your body to work right so that it will rebuild your knee and make your knee better. So what makes our office different? Basically, we leave no stone unturned to find out what's causing your knee problem. We don't want to just treat the symptom. We want to figure out why it's bad, fix that, and help rebuild, repair that tissue as much as possible. So how are you going to help your knees? First, we're going to find out through the examination process what's causing your knee problem. Then we're going to strengthen the muscles around the knee. We're going to repair the damaged tissue, giving you very high-tech supplements. We're going to repair the tissue using the cold lasers and the decompression. And then through the neurological exam, we're going to find any imbalances in your brain and nerve system and balance those back up. That in combination helps correct your knee problem. I had a gentleman come to my office years and years ago, my second year of practice. I guess I was 95, that was 35 years ago. He comes into my front door. He was 93 years old, was about 5'4", and weighed 100 pounds wet. He walks in the door with a limp, and his 94-year-old wife walks in behind him. And he goes, "Doc, you got to help me. My back is killing me." And they'd been married 71 years, and he accused her of robbing the cradle. But they were just precious. So I take him in the back, I examine him, look at him, I treat him. He gets off the table. "You know, I think I feel better already." He goes, "Good, because I got lots to do." I said, "Okay, good." So I walk him out to the front desk, and I say to him, "I'd like to schedule you next week for a follow-up." And he says, well, I can't come in next week. I said, well, why not? He says, I'm too busy. I said, you're too busy? He goes, and she says, yeah, he's too busy. And she pulls out this planner and she opens it up on her counter. And I'll be darned if for the next 2 weeks, every single day, every hour, he has something penciled in. Monday through Friday for the next 2 weeks. He says, Doc, on Fridays I go down to the senior center to visit the old folks. And I thought, this guy's my hero. I want to be like him when I'm 93 years old. He's going to visit the old folks. He's coming by. He's got no walker, no crutches, no wheelchair, living life to its fullest. I mean, the body was designed to last a lifetime. We have way too many degenerative problems in our society today. Life should be sweet and live fully. So let's cover some 3 common questions I get. First is, how long will it take to get better? That's a tough question. It depends how far along your degeneration is in your knee. With any of the, if you're a grade 1, it doesn't take as long as you're a grade 4. But that being said, about all the patients we see, within the first 2 weeks, they have pain relief, which is notable. They're walking better at 3 weeks. We typically are going to treat over the course of 6 weeks to 90 days, 3 months. And in that time, you're going to get great stability, great correction to the problem. How much does it cost? Again, that depends upon how long you've had your problem and what's wrong with your knee. So depending upon if you need 1 therapy or 3 or 4 therapies, that varies. Does insurance cover this type of care? The answer to that is no. And it's a frustrating answer for lots of people. But it frustrates me too. I pay high insurance deductibles, high insurance premiums, and my insurance doesn't cover the type of care I want. Insurance today is meant to cover standard medical care, and that's what you've received so far for your knee is standard medical care. Well, standard medical care doesn't really work very well with chronic problems. I mean, they don't even have codes for what we do. So this type of care they consider elective care. I mean, it's up to you. And people really have been exposed to that for a long time. Braces for teeth were not covered with insurance, and LASIK eye surgery. There's things that just aren't covered. That being said, are you worth paying money to help you be better? I mean, people will go out and, typical used car costs $7,000. People pay $7,000 for a chunk of steel. I mean, what are you willing to pay to get your life back and let you enjoy life? I mean, if you're 70 years old, you could have, another 10, 20 years ahead of you. Life is short. Life is sweet. You're worth it. But there is definitely out-of-pocket expense. So, what's in it for you? It's also what's in it for me, because we just love working with chronic patients and people with knee problems. It is just so much fun to watch them get better, and we just look forward to the comments we get back in, like, I can walk without pain. I'm playing with my grandkids again. I'm going on that trip I want to go on for the past 10 years, and I couldn't do it because my knee hurt so bad. I'm back in the garden. My wife doesn't need to help me put my shoes on anymore. Just a variety of things, and it's so nice to get a quality of life back again. And that's what's in it for you. And it's what's in it for me too, because it's just so much fun to be that instrument to help you get better. So what's next? Schedule a consultation. Here's what will happen. You'll come in for your first visit, and because you've watched this video, there's no cost for your first visit. You'll come in and we will do a consultation and discuss your concerns and your goals. You'll bring in x-rays or MRIs or whatever, blood tests, anything like that you have, and we'll review those. And we may want to see other blood tests as well, depending upon what I see on that blood test. You also have intake forms that you filled out, and we'll review all those. If I look at that and you look like you'd be a good candidate for this type of integrative care, we would then recommend a functional neurological exam. After the exam, we would then treat you, and we'd treat you for what the exam indicated you need. And then we'd reschedule you for a second visit. At that second visit, you'll come in and tell us how you responded to that first treatment. After hearing your response, I'll then decide whether I'm going to accept your case or not. If we accept your case, we'll then go through and describe to you all the exam findings we found at visit 1. We'll go the treatment plan, how long it will take, what it will cost, everything. So at that point in time, you'll then have all the information you need to make your decision of how you want to proceed. So a couple things to just consider at this point is, on a scale of 1 to 10, how bad's your problem? If your problem's a 1 or a 2, that means you're probably a grade 1, and it wouldn't take you too long to get better. However, I find that people that are an 8 to a 10 are much more motivated to do something right now because their lives are severely impaired, and they're just not living the quality of life they want to. Other question is, how has your problem affected your daily life, your quality of life, and your people around you, their quality of life? That's a very serious consideration. And where do you see yourself in the next 2 to 3 years? I mean, knee problems like this don't typically just get better. So time to take some action, do something about it. So we encourage you to schedule a consultation. I hope you enjoyed this presentation. If you have any questions, you can feel free to call the office. We're always glad to answer questions, and we look forward to you making an appointment for a consultation. You have a great day.